What if I told you that by the time you finish watching this video, dozens of families will receive life-changing news that a loved one has developed dementia? Most people immediately assume that aging is the only explanation. But after spending years caring for patients, I have learned that the story is often much more complicated. In some cases, the real trigger is hiding in plain sight, sitting inside a medicine cabinet, taken every day without a second thought, because it was recommended, prescribed, or sold over the counter. That possibility deserves far more attention than it receives. Over the years, I have watched intelligent, independent people slowly begin forgetting familiar names, missing important appointments, losing track of conversations, or becoming confused on roads they had driven for decades. Friends and family usually blamed age, believing this was simply the normal course of getting older. Yet in many of those situations, age was only part of the picture. A medication was quietly interfering with the way the brain stores and retrieves information. Because the prescription came from a trusted source, almost nobody questioned it. Modern research continues to reveal something many people never expect. Certain commonly used medications can interfere with memory, learning, and mental sharpness much sooner than most realize. Some of these drugs are taken by millions of older adults every single day, yet very few people are warned that cognitive side effects may develop gradually over months or years. Today, I want to walk you through 9 medications and medication groups that have been repeatedly linked with memory decline in older adults. We will move from the ones that are often overlooked all the way to the one I believe deserves the greatest attention. Make sure you stay with me, because one medication near the top of this countdown is prescribed for a condition that sounds completely harmless. Yet, it may quietly affect the very part of your brain responsible for forming new memories. Before we begin, I'd like to know a little about you. Tell me your age in the comments and let me know which medications you take every day. I read your comments carefully, and they help me decide which health topics to explain in future videos. Now, let's begin with number 9. At first glance, this medication hardly seems dangerous. In fact, it is probably sitting in medicine cabinets across the country right now. Number 9 is diphenhydramine, commonly known by the brand name Benadryl. Many people reach for it when seasonal allergies flare up, when a cold makes sleeping difficult, or when they simply want help falling asleep. Because it is inexpensive and available without a prescription, it has earned a reputation for being harmless. Unfortunately, what happens inside the brain tells a very different story. Diphenhydramine belongs to a category of medications known as anticholinergics. Although the name sounds technical, the basic idea is simple. These drugs reduce the activity of acetylcholine, one of the brain's most important chemical messengers. Acetylcholine plays a major role in helping us stay alert, process information, and create new memories. As we grow older, our brains naturally produce less of this chemical. That means older adults have much less reserve, making them far more sensitive to anything that blocks its function. One of the areas most affected is the hippocampus, a small structure deep inside the brain that acts like a memory processing center. Every new experience, conversation, or piece of information passes through this region before becoming a lasting memory. When acetylcholine activity is repeatedly reduced, the hippocampus cannot work as efficiently. Instead of noticing one dramatic change overnight, many people experience a slow decline that feels almost impossible to recognize. They begin forgetting small details, struggling to focus, or needing more reminders than they once did. Because the changes happen gradually, few people ever suspect the medication they have been taking for months or even years. During my career, I have met patients who faithfully took a nighttime antihistamine every evening, believing they were simply improving their sleep. Months later, they described persistent brain fog, increasing forgetfulness, and difficulty concentrating. Almost none of them connected those symptoms with the little pink tablet beside their bed. Yet growing scientific evidence suggests that connection deserves serious attention. Several large studies have reported that long-term use of strong anticholinergic medications is associated with a significantly greater risk of developing cognitive impairment and dementia in older adults. While these studies do not prove that every person taking these medications will develop memory loss, they provide a strong reason to review whether continued use is truly necessary. especially when safer alternatives exist. So what should you do? Start by reading the labels on every medication you use for sleep, allergies, or nighttime cold relief. Many products marketed for evening use contain diphenhydramine even when the brand name looks completely different. If allergies are the reason you take it, ask your healthcare professional whether a newer antihistamine with much less effect on the brain could be appropriate for you. The goal is never to stop medication on your own. Instead, the goal is to make informed decisions together with your physician while protecting both your physical health and your cognitive function for years to come. That brings us to number 8, another medication that helps one part of the body while quietly placing stress on another. This next group is prescribed every day for heartburn and acid reflux, yet very few patients are told how long-term use may influence the nutrients their brains depend on. Now let's continue with the next medication group, because this one surprises many people. It is prescribed every day for acid reflux, heartburn, and stomach ulcers. For countless individuals, it has become part of their daily routine, sometimes for years without a second thought. These medications are known as proton pump inhibitors, or PPIs. They are effective at reducing stomach acid, and for many patients, they provide tremendous relief. But like every medication, they come with trade-offs that deserve careful consideration, especially when they are used for long periods without regular review. Your stomach acid serves a purpose beyond digestion. It helps release important nutrients from the foods you eat so they can be absorbed into your bloodstream. Among the most important of these nutrients is vitamin B12, which plays a critical role in maintaining healthy nerve cells and supporting normal brain function. Magnesium and calcium are also influenced by long-term acid suppression, and both contribute to healthy communication between brain cells. When these nutrients gradually become depleted, some people begin experiencing symptoms that are easy to mistake for normal aging. They may notice increasing forgetfulness, trouble concentrating, slower thinking, unusual fatigue, or a general feeling that their mind is no longer as sharp as it once was. Researchers have explored this relationship for years. While not every study reaches the same conclusion, several large observational studies have suggested that prolonged PPI use may be associated with a higher likelihood of cognitive decline in some older adults. This does not mean these medications directly cause dementia, but it does highlight the importance of using them thoughtfully. Often, the greatest concern is not taking a PPI for a few weeks while healing an ulcer or controlling severe reflux. The concern arises when the medication remains on the prescription list for many years without anyone asking whether the original reason still exists. If you take one of these medications every day, don't stop it suddenly without speaking to your healthcare provider. Instead, ask an important question: do I still need this at the same dose? For some people, lifestyle changes, such as reducing late-night meals, maintaining a healthy weight, limiting alcohol, avoiding tobacco, or identifying foods that trigger reflux, may reduce the need for long-term medication. Others may benefit from stepping down to a different treatment plan under medical supervision. The goal is always to balance symptom control with long-term health. Now let's move to another medication that is rarely discussed outside a doctor's office, yet millions of older adults receive it every year. I'm talking about certain medications used to treat an overactive bladder. Frequent urgency, unexpected leakage, and interrupted sleep can have a major impact on quality of life, so it's understandable why many people seek relief. Unfortunately, some of the older medications commonly used for this condition work by blocking the same chemical messenger we discussed earlier, acetylcholine. That matters because acetylcholine is involved in much more than bladder function. It is also essential for attention, learning, and memory. When a medication reduces its activity throughout the body, the brain can become an unintended target. In some older adults, prolonged use has been associated with increasing mental fog, slower recall, and reduced concentration. The changes usually develop gradually, making them difficult to recognize until they begin affecting everyday activities. Fortunately, treatment options have improved. Today, there are newer therapies that control bladder symptoms through different biological pathways and appear to have less impact on cognitive function. They may not be appropriate for everyone, but they are worth discussing with your healthcare provider if you have noticed changes in your memory after starting treatment. Every person's medical history is different, and finding the safest option often requires an individualized approach rather than a one-size-fits-all solution. This brings us to another group of medications that often generates strong opinions: statins. These cholesterol-lowering drugs have saved countless lives by reducing the risk of heart attack and stroke. That benefit is well established, and for many people, statins remain an essential part of preventive care. At the same time, a small number of patients report experiencing memory changes or difficulty concentrating after beginning therapy. Scientific studies have produced mixed findings. Some suggest a possible association in certain individuals, while others show no overall increase in dementia risk and even hint that improved cardiovascular health may protect the brain over the long term. The important lesson is not to fear statins, but to recognize that every medication should be monitored. If you notice new symptoms after starting any prescription, including a statin, document when they began and discuss them with your physician. In some cases, adjusting the dose, switching to another statin, or investigating other possible causes may solve the problem while preserving the cardiovascular protection these medications provide. Medicine works best when treatment is personalized, and that requires an ongoing conversation rather than silent assumptions. Before we continue to the next medications on the list, take a moment to think about your own prescriptions. Do you know why each one was started? Has anyone reviewed them within the past year? Medication reviews become increasingly important as we get older because even appropriate treatments can interact with one another in unexpected ways. A simple conversation with your doctor or pharmacist can sometimes identify opportunities to reduce unnecessary medications while maintaining the same level of care. Those small adjustments may make a meaningful difference not only for your physical health, but also for preserving the clarity and independence that every one of us hopes to keep as we age. As we move further down this list, I want to shift the focus away from individual medications for a moment and talk about something equally important: duration. Many people assume that if a medicine has not caused problems during the first few weeks, it must be completely safe for long-term use. Unfortunately, the brain doesn't always react that way. Some changes develop so gradually that they blend into everyday life. A person may need a little more time to remember names, lose track of conversations more often, or find it harder to organize daily tasks. These changes are easy to dismiss because they rarely happen overnight. Instead, they accumulate quietly, making it difficult to recognize that something has changed until family members begin noticing it as well. That is why regular medication reviews become more valuable with each passing year, particularly for older adults who take several prescriptions at the same time. One category that deserves careful attention includes medications used to treat anxiety and persistent insomnia. When someone has struggled to sleep for weeks or months, finally getting a full night's rest can feel life-changing. Likewise, for people living with severe anxiety, certain medications can provide rapid relief during extremely difficult periods. The challenge appears when these medicines remain part of a person's routine for much longer than originally intended. Some medications in this category work by slowing activity throughout the central nervous system. That calming effect is exactly what makes them helpful in the short term. However, if the brain remains in a chemically slowed state for long periods, some individuals begin noticing reduced alertness, slower processing speed, impaired balance, and increasing difficulty forming new memories. Older adults are especially sensitive because the body breaks down many medications more slowly with age, allowing them to remain in the system for longer periods than they would in younger adults. This doesn't mean everyone taking these medications will experience cognitive problems. Many patients use them appropriately under close medical supervision and benefit greatly. The key message is that they should be viewed as part of an ongoing treatment plan rather than a permanent solution without regular reassessment. If anxiety or insomnia continues for months, it is reasonable to ask whether the current approach remains the best option. In many cases, combining lifestyle changes, behavioral therapy, stress management techniques, improved sleep habits, and carefully selected medications may provide better long-term results than relying on a single prescription indefinitely. Decisions like these should always be made together with a healthcare professional, because suddenly stopping certain medications can create serious withdrawal symptoms and may even become medically dangerous. Now let's discuss another medication that often surprises people because it has been prescribed for decades and continues to be used for several different conditions. Some older antidepressants are also prescribed for chronic nerve pain, migraine prevention, and sleep disturbances. Their versatility explains why they remain common in clinical practice. Yet some of these medications also have strong anticholinergic properties, meaning they reduce the activity of acetylcholine, the same important brain chemical we discussed earlier. When that pathway is repeatedly affected over months or years, some older adults may begin experiencing problems with attention, short-term memory, and mental clarity. These side effects can be subtle enough that they are mistaken for normal aging rather than being recognized as potentially medication-related. Fortunately, medicine continues to evolve. Newer treatment options are available for many of these conditions, and some have a lower likelihood of affecting cognitive function. That does not automatically make them the right choice for every patient, but it creates an opportunity for informed discussion. If you have been taking the same medication for many years, ask your physician whether today's evidence suggests a better alternative. Healthcare changes rapidly, and treatments considered standard 20 years ago are not always the first choice today. Regularly reviewing long-term prescriptions is one of the simplest ways to ensure your treatment plan reflects current medical knowledge rather than outdated habits. There is another important principle that often gets overlooked. Not every episode of forgetfulness is caused by medication. Poor sleep, uncontrolled diabetes, hearing loss, depression, thyroid disorders, vitamin deficiencies, dehydration, infections, and even chronic stress can all influence cognitive performance. That is why a careful medical evaluation is essential before assuming memory changes represent dementia. In some cases, identifying and treating one of these reversible causes leads to remarkable improvement. The brain depends on the health of the entire body, and protecting memory often means looking far beyond the nervous system itself. Before we move into the final part of this discussion, I want you to remember one simple idea. Never judge a medication solely by how common it is. Some of the most frequently used prescriptions have tremendous benefits, while others require closer monitoring in certain individuals. The safest approach is not fear, it is awareness. Ask questions. Understand why you are taking each medication. Know its expected benefits, possible risks, and whether it still serves an important purpose in your current stage of life. Those conversations may seem small, but they can have a lasting impact on maintaining independence, mental sharpness, and quality of life as the years go by. There is another question I encourage every patient to ask, and surprisingly, it has nothing to do with the name of a medication. Instead, it is this: what happens when this medicine is combined with everything else I'm taking? Modern medicine has allowed people to live longer than ever before, but with longer life often comes a growing list of prescriptions. A medication for blood pressure is added, then another for cholesterol, something for allergies, something to help with sleep, a tablet for bladder symptoms, perhaps a medicine for anxiety, stomach discomfort, or chronic pain. Individually, each prescription may be entirely appropriate. The concern begins when several medications influence the same body systems at the same time, without anyone stepping back to look at the complete picture. Think of the brain as an orchestra. Every section has its own role, and together they produce the harmony that allows us to think clearly, solve problems, recognize loved ones, and create new memories. If one instrument becomes quieter, the performance may continue with little noticeable difference. But if several sections gradually lose strength together, the music changes. The same principle applies to medications. A very small effect from one prescription may not be obvious. Several small effects acting together can become much more significant, particularly in an older brain that has less physiological reserve. This is why medication reviews become increasingly valuable as we age. They are not about removing medicines simply because someone is getting older. They are about making sure every medication still provides more benefit than risk. Another point that deserves attention is hydration. And it may sound almost too simple to mention, yet dehydration is one of the most common reasons older adults suddenly develop confusion or worsening memory. Certain medications increase fluid loss through the kidneys, while others reduce the sensation of thirst. An older adult may not realize they are becoming dehydrated until symptoms begin affecting their concentration, balance, and overall mental function. Something as straightforward as correcting dehydration can sometimes produce a dramatic improvement. That is why physicians often look at basic factors first before assuming that memory changes represent irreversible disease. Nutrition also plays a larger role than many people realize. The brain is one of the body's most energy-demanding organs. It requires a continuous supply of oxygen, healthy fats, vitamins, minerals, and stable blood sugar to function efficiently. When medications interfere with appetite, digestion, or nutrient absorption, those effects may eventually influence cognitive performance. This does not mean supplements are the answer for everyone. In fact, unnecessary supplements can create problems of their own. The better approach is identifying true deficiencies through proper medical evaluation and correcting them in a targeted, evidence-based manner. Physical activity deserves equal attention because movement benefits far more than muscles and joints. Every time you walk, cycle, swim, or perform another form of regular exercise, your heart pumps more oxygen-rich blood throughout your body, including your brain. Exercise also stimulates the release of natural growth factors that help maintain healthy connections between nerve cells. Numerous studies have shown that regular physical activity is associated with better cognitive performance and may help reduce the risk of future decline. It doesn't require marathon training. Consistency matters far more than intensity. Even moderate daily movement can become one of the strongest investments in long-term brain health. Sleep is another area that cannot be ignored. During deep sleep, the brain performs essential maintenance that most people never think about. It strengthens important memories, removes metabolic waste products, and prepares neural networks for learning the next day. Chronic sleep deprivation interferes with all of these processes. Interestingly, people sometimes respond to poor sleep by taking stronger and stronger sleep medications without first investigating why they are sleeping poorly in the first place. Conditions such as sleep apnea, chronic pain, depression, restless legs syndrome, excessive caffeine intake, or poor sleep habits may all be contributing factors. Treating the underlying cause often produces better long-term results than continually increasing medication. Equally important is staying mentally engaged. The brain responds to challenge much like muscles respond to exercise. Learning a new language, practicing a musical instrument, reading regularly, solving puzzles, volunteering, teaching others, or simply maintaining meaningful conversations all encourage the brain to remain active. Social connection is particularly valuable. Isolation has repeatedly been linked with poorer cognitive outcomes, while regular interaction with friends, family, and community groups appears to support emotional well-being and mental resilience. Protecting memory is not accomplished through a single pill or one perfect habit. It is built through many small decisions repeated consistently over time. As we approach the end of this discussion, I want you to remember that memory changes should never be ignored, but they should also never lead to panic. Many causes of cognitive symptoms are treatable, and some are completely reversible when identified early. The most important step is paying attention. If you, or someone close to you, notices increasing forgetfulness, difficulty concentrating, confusion, or changes in daily functioning, schedule an evaluation rather than assuming it is simply part of getting older. Early assessment gives you the greatest opportunity to identify reversible factors, optimize medications, and protect long-term brain health. Knowledge is one of the most powerful tools we have in medicine, and asking the right questions today may help preserve independence for many years to come. As we reach the final part of this discussion, it is important to step back and connect everything together. Memory is not controlled by a single organ, and it is not shaped by a single factor. It is the result of many systems working in coordination every single day. The brain depends on steady blood flow, balanced chemistry, proper nutrition, restorative sleep, and an environment free from unnecessary stress on its networks. When any of these elements are disrupted for long periods, changes in thinking and recall can begin to appear. Sometimes those changes are subtle at first, and sometimes they are wrongly attributed to aging alone, when in fact there may be multiple contributing factors working quietly in the background. One of the most important themes throughout this series has been awareness. Many medications that people take daily were prescribed for very valid reasons. They often improve quality of life, reduce pain, stabilize mood, control blood pressure, or prevent serious complications. The concern is not the existence of these treatments. The concern arises when they continue for years without reassessment, or when multiple medications overlap in ways that no one has reviewed as a complete system. Medicine works best when it evolves with the patient, not when it remains frozen at the point it was first prescribed. This is why periodic medication reviews are one of the most powerful but underused tools in healthcare. A structured review with a physician or pharmacist can sometimes reveal patterns that are not obvious in day-to-day life. A medication that once served an important purpose may no longer be necessary. Another may be available in a safer alternative form. In some cases, simply adjusting timing or dosage can reduce unwanted effects on cognition and overall function. These are not dramatic interventions. They are careful refinements that accumulate into meaningful long-term benefits. It is also important to recognize that brain health is deeply connected to the rest of the body. Vascular health plays a major role, meaning the condition of your heart and blood vessels directly influences how well your brain functions over time. Metabolic health matters as well. Conditions such as diabetes, high blood pressure, and high cholesterol can all influence cognitive performance if not properly controlled. This is why protecting memory is never about focusing on one isolated factor. It is about supporting the entire system that keeps the brain nourished and stable. Another key message is that early attention makes a difference. When changes in memory or thinking are identified early, there is often a wider range of options available. Adjustments to medications, correction of deficiencies, treatment of sleep disorders, or addressing underlying medical conditions can sometimes lead to noticeable improvement. Waiting too long reduces those opportunities. This is why it is so important not to dismiss cognitive changes as something that must simply be accepted without question. The earlier you investigate, the more possibilities remain open. At the same time, fear should never replace understanding. The goal of this information is not to create anxiety about medications that many people genuinely need. Instead, it is to encourage a more thoughtful and informed approach. Every medication has both benefits and potential risks. The safest path forward is not avoidance, but awareness. When you understand what each treatment is doing in your body, you are in a stronger position to work with your healthcare provider to ensure it still fits your needs. If there is one practical step to take away from everything discussed in this series, it is this. Schedule a full review of your medications if you have not done so recently. Bring every prescription bottle, every over-the-counter product, and every supplement you take. Ask simple but important questions. Why am I taking this? Is it still necessary? Are there safer alternatives available today? Could any of these be contributing to the symptoms I am experiencing? These conversations are not about challenging medical advice, but about participating actively in your own care. Finally, remember that cognitive health is not defined by a single moment or a single diagnosis. It is shaped over time by the daily choices we make and the medical decisions we review along the way. Many people experience changes in clarity, focus, or memory at some point in life, but not all changes are permanent, and not all are irreversible. The human brain has a remarkable capacity to adapt and recover when underlying causes are addressed early and appropriately. If you found this series helpful, consider sharing it with someone who may benefit from a closer look at their medications or their overall brain health. Sometimes the most important changes begin with a simple conversation. Stay informed, stay curious, and stay proactive about your health, because protecting your mind is one of the most valuable investments you can make in your future.